Hey everybody, this is Beth and Rachel from Wellness 360. We're here to give your caregivers some tips and make things at home make a little more sense and be a little easier for you. So today, Rachel is our PT. She's going to be demonstrating the safety precautions and how to correctly use a gait belt. Rachel, take it away.
So here's your standard gait belt. There's two sides of the gait belt. One that has something that kind of looks like a comb, and then another open side. So I'm going to show you how you put this on Beth. Beth, please have a seat. So when you're looking at the gait belt, there's typically a tag. You want that on the inside. You also want the teeth or the comb on the inside as well. So you're going to say, I'm going to give you a little hug. You're going to put the end of the gait belt through the tooth end, make it snug, and then you can loop it back through the other end. Now you want this to be snug because you want to be able to get close enough and have enough sturdy hand on the patient, but you also want to be able to fit your hand underneath. So what we're going to do is we're going to show you how to do a sit to stand with the gait belt present. Something you want to remember is you do not want to really be pulling up a patient by their arms. That can cause a lot of shoulder pain for the patient, but it is helpful sometimes in a cueing purpose. So Beth, we're going to scoot to the edge of the chair, which you are gladly there. Yeah. So now you're going to bend forward, nose over toes, and stand. So I do have my hand underneath her arm, but I'm not pulling up from there. I have my hand around the back of her, nice and snug. And when she stands up, you want to kind of double check that everything is still nice and snug, as this is going to be for safety purposes to make sure that your patient or your spouse is safe. If you have any other questions, feel free to give us a call or reach out to us. Thank you.